There are various causes of shoulder pain. In our regular OPD, we are seeing many patients who are coming to us with shoulder pain. Not only a shoulder pain, but rather they also say that there is limitation of movement. That means they are not able to raise their hand against gravity, or you can say they cannot raise their hand more than 90 degrees. Sometimes they say that we are not able to raise any objects from down, or we cannot take our hands back, we are not able to wear our clothes, we are not able to comb our hair. In a way, we can say the movement is limited or restricted because of some kind of pain as well as some kind of adhesions. So if we categorize this kind of shoulder pain, there are various causes. The number one is youngsters. You can say somebody who is regularly playing, maybe because of either tennis players, badminton players, somebody who is playing cricket, who is regularly activities like throwing activities are there. So in those subjects, we can say there is some sort of tissue injury that occurs inside the joint. There are ligament tear, because there are various ligaments around the shoulder joint which causes the stabilization of the joint. But due to repeated movements, if there is any tear in those joints, so that can cause pain in the joint. Number two cause, if there is any accident because of some fall or something, you have got a trauma over the shoulder joint, then you can got maybe initial stages, you may not have that kind of pain, which is also, even if you are having a pain, that is getting subsided with the painkillers or different kinds of anti-inflammatory medications. But gradually, as it heals up, you will see that you are not able to raise your hand and restriction of movement is there. Again, that can be because of some bony injury, some cartilaginous injury inside the joint, or it can be because of, again, those muscles or ligaments are there around the joint, they are affected because of that trauma. So that may lead to restriction of the movement and pain. Another cause, this is a very common, is arthritis. Either it can be a arthritis like a rheumatoid arthritis, which is because of a disease, you can say, is an autoimmune disease where all the joints in the body are affected, including your shoulder joint. So those patients will have various joint issues. Along with that, this is another joint which is affected. So that becomes very easy for us to diagnose, because along with multiple small joints, they will have another shoulder pain. So these are the basic causes for which you will be having a shoulder joint pain as well as you can have restriction of the movement. So if we broadly say, it can be a frozen shoulder. Normally in colloquial languages, whenever a patient comes, normally we say, okay, you are not able to raise your hand, it can be because of a frozen shoulder. Now frozen shoulder, in technical terms, we call it as a adhesive capsulitis. So initially, whenever a patient comes, what we start is medicines. Those medicines are basically anti-inflammatory drugs which causes the inflammation to reduce down. If even after that you are not getting a proper solution, in the OPD only, what we do is we do a diagnostic ultrasound. Through that diagnostic ultrasound, many a times we found some kind of fluid is there inside, some kind of inflammation is there, or if there is a ligament tear, that can be easily diagnosed. But even after that, if we want to confirm it, what is the cause, then we send the patient for MRI. In MRI, properly we can see if there is any kind of ligament injury because of overactivity, or there is a arthritis component for which there is a adhesion. So that can be properly diagnosed after an MRI. Now, what are the treatments after you get an MRI? Now here it comes like, after the medications, we send the patient for physiotherapy. With tremendous physiotherapy and exercise, usually those who are having a normal amount of inflammation, that gets subsided, so that patient starts moving their hand and they can come back to their routine activities. But if there is a tear, suppose there is a ligament and there is a tear in the ligament because of this overactivity or because of the trauma, then it won't heal. What we do in those cases, there is a magical therapy, you can say, that is called PRP therapy. That is a platelet rich plasma therapy. What you do is, we take out your blood and we prepare the platelets from that, and that concentrate platelet is being infiltrated in those areas where there is a tissue injury around the joint or inside the joint also. So that gradually helps in healing, or that is called a regenerative therapy. So with that regenerative therapy, the tissue grows again and if there is a ligament tear, if there is a partial ligament tear, that will again heal up. So that along with that regenerative therapy, if we do a regular exercise and physiotherapy, then it gets cured almost. But think about those patients who are having it severe arthritis. Because of the arthritis, there are extra bony growth, there is no cartilage, there is no fluid. So if that causes a restriction of movement and you don't have, like PRP won't work, medicines won't work. Suppose somebody is like 80, 85 years old patient, and even after hydrodissections, sometimes what we do is, there is another term called hydrodissection. So what we do, simply we put injections into the joint and a lot of amount of fluid so that it swells up, and that releases that adhesion. That is again a beautiful thing that comes out for the older patients. But even after that, if somebody is complaining of pain, then we go for a radio frequency ablation. That is called a cooled radio frequency ablation. We just ablate the nerves around the joint. Those are basically sensory nerves, so that your joint will be painless and you will be able to do physiotherapy. Now, because the main aim in treating a frozen shoulder or any of the shoulder injury is physiotherapy or regular exercise, we just let you do the physiotherapy without pain, and if there is severe pain, you won't be able to do the physiotherapy. So all these modalities will help you in reducing down the pain and will allow you to do the physiotherapy. And the best thing is the radio frequency ablation for those who are not getting any kind of cure after injections, medicines and everything. I can say that you'll get 100% pain relief with this kind of nerve ablations. But those who are young patients, again they want to come back to their normal life as soon as possible. PRP therapy works wonderfully, and almost I can say that cures all kinds of ligament injury, or we can say there is a rotator cuff tear, that is because of all the 4 ligaments that are around the joint, if there is any tear in that. So that also gets cured with this PRP therapy. So these days this PRP therapy and everything is available at the pain clinic. If you are suffering from any kind of shoulder injury, which is maybe because of arthritis, maybe because of trauma or anything, do visit a pain clinic, which will give you an array of treatment which are non-surgical, and we try to get back to the normal life as soon as possible.